Okay. All right. Well, thank you for being here. I'm Zach Gross. I'm the Director of Supportive Housing Programs at IHCDA. I'm working with the Community Services team at IHCDA, sort of a other sort of side of the house here that normally handles continuum of care programming, and our side handles more of the capital funds. So we're working together on this, and I'm happy to present the webinar on the CoC builds NOFO for 2026. So as you probably know, there's really not much time to get an application in, and there's a lot to go over, a lot of requirements, a lot of questions that need answered. So I'm hoping to provide some overview of that, and answer what I can. If there's anything I can't answer, I'll do my best to get that for you or direct you to somebody who can answer it. I will say that the NOFO it's not necessarily complicated, but there's just a lot of pieces in there. So I do encourage you to go ahead and read that yourself and make sure you understand, what the expectations are, and what the requirements are to submit. So the timeline for the NOFA, so HUD released it in June 23rd. We released our public notice on July 8th to solicit potential subrecipients for the NOFO. The deadline to submit the project interest letter to IHCDA is on July 17th by 5 p.m. And then just the next week, on July 23rd, is the deadline to submit the full builds application to HUD. So we have to have everything in to HUD no later than July 23rd. And so we're kind of working backwards from there. July 17th, we want to see the full letters. Of course, we'll have to be working pretty quickly to turn all of that into one cohesive application. And if you do decide to submit an LOI, we encourage you to, be open to working with us and be a little flexible in those handful of days there between the 17th and the 23rd, because there will likely need to be some follow-up and additional questions that need answered and things like that. So we appreciate the flexibility, and know there's not much time here, and just want to say in advance, please be mindful of that. Thank you, and thank you for the flexibility. So some eligibility pieces and requirements for the funding. So to be eligible to apply, you must be a nonprofit, local government entity, housing agency, tribal entity, and have lived experience representation on your board. So we anticipate most likely that all the subrecipients would be nonprofit organizations, 501c3s. A local unit of government could potentially apply as well. And you must use GAAP accounting principles to operate the award and report expenses for the award. Want to see some good financial management practices, and have the ability as an organization to operate this on a reimbursement basis. So that means, floating some of the expenses on construction costs and things like that, which could be a financial burden for some organizations, but we'll have to submit these as reimbursement based. So that's an unfortunate requirement here for this grant. You have to be able to file on-time monthly claims. And then importantly, there is a match requirement for CoC builds. So you have to be able to match 25% of the funds from eligible sources on eligible activities. So other CoC funds do not count as match. If you have other funding coming into the development, other sources, LIHTC, home, vouchers, anything like that, those could be match funds, services provided from another agency that could count as match. So there's a lot of ways to meet that, but that is a requirement. Required documentation. So we need to see that you're registered to do business with the Secretary of State, that you're registered in SAM.gov and have a unique entity identifier. We need to see the match commitment letters and MOUs, and we'll go over that more in a little bit. And then this one is really important. So we do need evidence of site control at the time of application. So site control, this time around, this has changed. This is the fourth iteration, I think, of this CoC builds NOFO, and I think site controls changed in all of them. And so this time around, they want to see a lease or a deed unless you're requesting acquisition funds. So if you're requesting acquisition funds, then you can provide a purchase agreement. Otherwise, if it's only new construction or rehab, you have to have that lease or the deed. So just keep that in mind. Okay, so now I'll go over the opportunity a little bit from the HUD NOFA that was released, and then our call for subrecipients that we put out. So HUD's goals in this are increasing supportive housing for people with disabilities. So that is particularly for the elderly population. They specifically called that out. However, they're looking for projects that are targeting needs that are not met in communities by existing PSH. So specifically, they say in the NOFO that there's a lot of PSH, a lot of funding has gone to PSH, and in the regular CoC NOFO, they're prioritizing other types of projects, and because of all of the PSH that already exists, they want to see that this is filling a gap that is a real gap in the community, something that's not met by the existing PSH. So there's some questions in the NOFO, and those are mirrored in the LOI to get at this and to look at why there is a need. So just keep that in mind, that that's going to be important to show that there is a need. So that could be, it's a different population that is unserved by your current PSH in your community. Could be that there is no PSH in your specific community, or it's a very small number compared to the need that exists, and you have to, show that with data. Would be the best way to answer that, or some other way to demonstrate that there really is a need here. They also want to see partnerships with housing, health, and social service organizations. So basically, if you have a services partner, or you're bringing in services from another agency or another funding source, they want to see that. They want to see healthcare is available to residents and is going to be provided either on site or nearby in the community. And they want to see funds being leveraged. So they want to see, your development. It's not just CoC builds funding going into it. They want to see that you have some other sources of funds. And I think preferably, CoC builds would be not the largest source of funds from their perspective. So they want to see that you're leveraging funding to be able to meet the need and not just relying on this as a sole source. And they want to see finally that you're engaging participants in services and in the community. So and providing quality, that means providing quality services on site to engage participants and provide those services to assist them to live independently, and to facilitate community engagement within the property in question. So there's some questions as well that will get at that. So what is eligible for funding here? So supportive housing is the only eligible project type, and that each project has to request either rehab, acquisition, or construction costs. You can request more than one of these. It's not just one, but you have to request at least one of these. In addition, you can also request project-based rental assistance, administrative costs, supportive services. You actually can request some other things as well, other CoC eligible costs like HMIS, VAWA. I'll go into those in a little bit more detail later. But the core of the project must be the capital costs for housing, construction, rehab, or acquisition. So as I mentioned, we have to see construction, rehab, and/or acquisition for new PSH units. I don't think they're going to want to see um, rehab on existing PSH units. It's maybe a little unclear, but we can double check if somebody wants to do that. Um, so as I mentioned, you can request other costs, rental assistance, supportive services, HMIS, VAWA, rural and relocation costs. That funding cannot exceed in total 20% of the requested amount. So if you're requesting rental assistance and services, that it can only be 20%, up to 20% of the requested amount for your project. In addition to that 20%, project administration can be requested. That can't exceed 10% of the requested amount. Projects must be located in the balance of state CoC geographic area. That includes all areas of Indiana except for Marion County. So projects in Marion County have to go to the Indianapolis CoC to apply for CoC builds. Applicants must demonstrate site control at the time of application. And as I mentioned, site control for this means you have a lease or a deed unless you're applying for acquisition funding, and then a purchase agreement is acceptable. Projects must meet a 25% match requirement. And then if you're selected for award, a conditional award, after that selection, you'll have to complete a subsidy layering review and environmental review, and funding is expected to be available in October 2026. Moving into the LOI and looking more at what we're looking at and asking for. So um, essentially, we HUD and this is actually only allowing one project per CoC. And so the way that we are approaching this is that IHCDA will submit a project, and that will be the one project, and then we're able to apply for multiple subrecipients at different locations that's eligible. So our preference would be to apply and include all eligible subrecipients on that as subrecipients on the award. So our goal is to, identify and, get applications in from eligible projects and include them on the award in our response to HUD. So when we get an LOI back, we'll basically just be looking at sort of a threshold review and making sure we have everything we need to combine it into one cohesive project application. So we're going to be looking at, is this an eligible project type? Are the expenses eligible as allowable expenses and CoC builds? If it's just not the correct project type for the opportunity, or all the costs are just not eligible, we may not be able to include you in the response. Otherwise, we likely would. Is the project aligned with those principles and goals that we went over earlier? So increasing the needs, filling the gaps, and having partnerships and leveraging other funds, delivering quality services. Are those questions answered sufficiently in the LOI? Readiness for funding and experience. So there's some questions as well about just having experience, doing this kind of thing and developing housing, and we'll want to make sure that we are able to sufficiently answer those questions as well. And the healthcare and social services partnerships, so having the commitments from healthcare or service providers. So more on that. So what HUD's looking to see are for formal commitments or support letters or MOUs from social service agencies or healthcare providers that will be providing case management, healthcare, life skills training, substance use services, any of those kinds of services in the property. They want to see not just a vague, yes, we're going to be working with this agency, but something that's actually a commitment that they will be participating in the project with an assigned dollar amount attached to the value of those services. And to receive full points here, the amount of services provided must equal at least 20% of their request. So 20% of what you're requesting for award, we want to see that amount coming in from healthcare services partnerships. Or other funding sources as well, I think would qualify if you're providing them yourself. Healthcare, they want to see separately that healthcare is either on site or in close proximity provided by a nonprofit partner. So that is a separate requirement, and they also want to see a support letter or a formal commitment for that. So I think that we could probably include that, or include both of those on one support letter or commitment, as long as the wording it covers both of those topics, but that is technically a separate requirement. Housing partnerships. So I mentioned, they want to see us leveraging funding and bringing in outside sources. So formal commitments, including conditional commitments of capital funding. If you have rental subsidies, such as project-based vouchers, having those commitments and the dollar amounts attached, we'll be able to show that we're leveraging other funding with CoC builds. Okay, so the LOI has a lot of questions in there. Those are mostly just mirrored from the CoC builds NOFO. Some of them are reorganized a little bit or combined just to make it a little smoother to respond to. So we want to see responses to all those questions and the required information, attachments, and then we'll combine all of that information into one project application. Pay attention that you're, making sure you're clearly describing the number of units, location, the construction timeline, and provide enough detail that we have enough to work with there. And, hopefully the more detail you provide up front, the more it reduces kind of the back and forth we'll need to do in those handful of days before the application is due to HUD. So required attachments for this are the development budget, showing how much in CoC builds you're requesting, but also the overall, how that fits into the overall development. So we want to see the sources and uses. The certification of nonprofit status, showing an eligible recipient. Evidence of any funding commitments, including conditional commitments for capital funding, services funding, MOUs or agreements with service providers, showing how much, especially non-CoC funding, that you'll be bringing in into the project. An operating budget. Operating budget should not be there. So ignore that. Evidence of site control. So again, we need the evidence of site control, deed or lease, or purchase agreement if you're requesting acquisition funding. And then optional, so if you have these items, please submit them, or anything else that seems like it would fit and be relevant to the application. But not everybody will have these, so it's not necessarily a requirement. But a supporter service plan and budget, management plan, operating budget, if you have these items, that can help support the application and really bolster the strength. Okay, so the funding available to the CoC is up to 12 million that we are able to apply for. As I mentioned before, we are anticipating putting multiple projects into the IHCDA application, and then those sites will be subrecipients of one overall IHCDA award. I should note that this funding is incredibly competitive from the federal level. So HUD is anticipating making, I believe it's 8 awards total across the country. There is a certain number of those that have to go to rural CoCs or states, I think, and we do not qualify for that set aside. And I think there's at least a preference for tribal organizations, so we will not qualify for that as well because it only applies to federally recognized tribes. And so, we will be competing for a relatively small number of awards available. So of course we'll do the best we can and submit the best application we can, but just keep in mind that this is a incredibly competitive process. Okay, so the process, just to go over this one more time. So when you complete the LOI and provide the attachments, we'll review it for completeness and quality, make sure we have everything we need there. If everything seems right and there's no red flags that this might not be an eligible project or might not qualify, then we'll move forward with those projects. We'll send additional requests for information and just again be mindful that there's only a handful of days here, so just please be flexible and willing to provide the needed info so we can submit a good quality application. And then we will combine all of that information into one project application, submit that to HUD, and then HUD will notify us whether we have been selected or not. And then since this is a CoC process, just wanted to call out the different roles here and how the CoC kind of fits into this. So the CoC board will approve the overall application. IHGA as a collaborative applicant will develop the process. We develop the response, and as the project applicant, we will submit that to HUD and organize the application. The project applicant, which would be eventual subrecipients, we're asking that you complete the LOI and attachments, respond to additional requests for information, and secure the match commitments required. And again, we also encourage you to review the whole NOFO and make sure you understand the requirements and what you need to provide and what you're committing to. And with that, I will take any questions.
Okay, I have a list of questions.
Okay.
Starting with, can this program serve youth only?
Can it serve youth only? I believe